Hello, everyone. I'm Dr. Christian Ramers, Chief of Population Health here at Family Health Centers of San Diego. I'd like to welcome you and introduce you to a clinical trial being conducted in several of our primary care clinics called Enhanced Multi-Component Proactive Navigator-Assisted Cessation of Tobacco Use in Low-Income Patients, or as we call it, EMPACT-Us. This project is supported by the Tobacco-Related Disease Research Program, or TRDRP, with funds from the California tobacco tax, which was first authorized in 1988 by Proposition 99 and updated in 2016 by Proposition 56. This study is a collaboration between Family Health Centers and colleagues at the UCSD School of Public Health. And the co-PIs, or co-principal investigators, are Dr. Karim Gobriel-Sedki, who's the director of our Family Health Center's Adult Psychiatry Residency, and Dr. David Strong, a clinical psychologist and director of the Joint Doctoral Program at UCSD and San Diego State University. We're asking for your help to carry out an intervention in the primary care setting to help our patients who use tobacco products and who are ready to quit. We are not asking you to take on additional work beyond what you're already doing to care for your patients. Rather, this project provides streamlined tools to allow you to be more intentional and efficient about the way you approach treatment of tobacco use in your patients. Evidence suggests this intervention will increase your patients' chances of successfully quitting by engaging in supportive treatment, increase their number and frequency of attempts to quit, and ultimately achieve sustained cessation. Likewise, as we all know, successful tobacco cessation will thereby improve their overall health, prevent cancer, cardiovascular disease, and allow them to live a healthier lifestyle overall. We realize there are many competing priorities in a typical primary care appointment. We've therefore gathered all the available resources, updated them to current evidence-based standards, and bundled them so they're easier for patients to access and for you to implement. Changes have already been made over the past 2 years to the order sets in our EHR, and you may already be using some of these features. The EMPACT-Us suite of tobacco treatment services is embedded within the tobacco user order set and includes many tools designed to streamline appropriate care for our patients. First, you'll notice both an updated tobacco treatment medication list, as well as supportive behavioral counseling and resources. Several redesigned EHR smart phrases are available to help you document tobacco use assessment and counseling during these appointments. An updated decision aid on lung cancer screening has been developed based on the latest U.S. Preventative Services Task Force guidelines. We've included an expedited proactive referral to Kick It California, formerly known as 1-800-NO-BUTS, which results in a live phone call from a Kick It California quit coach within 3 days. There is now a revamped health education smoking treatment program at Family Health Centers. You have the opportunity to create a dedicated follow-up appointment in primary care just for tobacco treatment. It gives you and the patient more time to focus on this one important issue. And finally, we've integrated tobacco use into the Interact rooming process medical assistants use to collect information on your patients, involving their smoking history, smoking status, and their desire to quit. We hope through the EMPACT-Us project that you learn more about the available services for tobacco treatment for your patients, feel more confident in your prescribing and referral practices, and the way you can counsel your patients about tobacco treatment. One additional piece of support that this project provides patients is a follow-up text message conversation from study staff that serves as a gentle reminder to continue to engage on their quit journey. These text messages are triggered when any of the following occur: use of a tobacco-related smart phrase, a prescription of tobacco treatment or nicotine replacement therapy, referral to Kick It California and/or the FHCSD Tobacco Treatment Support Program, or setting of a quit date using the EHR Info tab. These text messages will also be used to ask about your patient's tobacco use status. However, they will not feed back into the patient's chart. Some of your patients will also receive a survey about their opinion on the suite of tobacco treatment services. Their answers are going to be de-identified, and results will be analyzed in aggregate to inform our processes. We will now view these training videos together and answer any questions at the end.
Today we'll talk about the tobacco use order set and smart phrases. Tobacco treatment includes tobacco treatment medications as well as behavioral counseling. Let's take a closer look to see what the tobacco use order set functions are. When ordering tobacco treatment medications, the order set guides you through a nicotine replacement step-down therapy and dosages needed to help your patients succeed in their quit attempts. And to help you order these medications, we have another video called How to Order Tobacco Treatment Medications. Scheduling a telehealth follow-up visit focused on tobacco treatment in 2 weeks or in 1, 2, or 3 months. We highly recommend it for patients who start on tobacco treatment to receive a follow-up visit. Placing referrals to KICA California, formerly known as the California Smokers Helpline, or the FHCSD Tobacco Treatment Support Program. We will tell you a little more about each one in later blurbs. By the way, research shows that combining behavioral counseling with tobacco treatment medications to curb cravings has the best evidence for success, providing smoking treatment resources and education to both the patient and the provider. You may also use the tobacco use order set to order a lung cancer CT screening, clinical reminders and after-visit summaries and advisories, and you can also easily load into the SOAP Note tobacco treatment smart phrases to save you time on documentation. It's that easy. If you have any questions, please don't hesitate to reach out sending an email to quitstudy@fhcsd.org. Thank you for watching and stay tuned for more short videos. These are the 2 available programs to refer your patient for tobacco treatment counseling: KICA California and FHCSD Tobacco Treatment Support Program. Research shows that combining tobacco cessation medications with behavioral counseling increases the chances of success. You and your medical assistant can refer patients to KICA California through an electronic referral process. This means that the patient won't need to do anything other than answering a phone call from a KICA California quit coach within 3 days after placing the referral. But what is KICA California? It's formerly known as the California Smokers Helpline, or the 1-800-NO-BUTS number. KICA California is a free statewide program funded by tobacco taxes that helps Californians quit smoking with the help of proven science-based strategies. It's available to everyone in California and is offered in multiple languages: English, Spanish, Mandarin, Cantonese, Korean, and Vietnamese. And KICA California also offers cessation counseling to quit vaping and smokeless tobacco. But what if your patient would like to stay within family health centers? Our FHCSD Health Education Department has a tobacco treatment support program. After placing the referral, your patient will be contacted by a patient service representative within 3 days to schedule an individual appointment with a health educator for tobacco use and readiness initial assessment. If the patient is ready to quit, they will be connected to a tobacco treatment support program facilitator who will conduct the sessions with an adapted, evidence-based tobacco treatment curriculum. These are free year-round smoking treatment sessions. The goal is to offer group sessions over the phone, but if the patient prefers a one-on-one session, it can also be accommodated. And finally, our health educators provide the services in English and Spanish. Don't forget that having the support of the primary care provider and someone to coach the patient through behavioral changes on the same journey increases the chances of quitting for good. The benefits of referring your patients to tobacco treatment programs? It increases quit attempts and prevents relapses. And while a single session can be efficacious, multiple sessions even more so. If you have any questions, please don't hesitate to reach out sending an email to quitstudy@fhcsd.org. Thank you for watching. The tobacco use information that EMA collects and interacts during the rooming process will be displayed in the EHR dashboard. You will see the patient's smoking status and quit date, if one was set, displayed above the SOAP notes. Patients who have tobacco user on their problem list should get asked every visit if the status has changed, and the ones who don't have it are asked every 11 months. If a patient sets a quit date through a tobacco treatment support program like KICA California or FHCSD Tobacco Treatment Support Program, or if your MA updated the quit date, you'll see it displayed here. These programs are explained in the video titled Tobacco Treatment Counseling Programs, KICA California and FHCSD. These status updates may prompt you to discuss whether the patient needs additional behavioral support and/or pharmacologic options for their cessation efforts. Keep in mind that the likelihood of a successful quit attempt is increased if counseling is provided along with the medications. If you notice that the patient's tobacco use information collected by the MA is not up to date, prior to closing the encounter, you will be able to update this information under the Info tab. Scroll down until you see the Substance Use section and click on the respective fields to input the updated information. If a new quit date is created, it will be updated when the page is refreshed. This allows you to have accurate information to work with in future visits. In addition, this vital information goes into the EHR's Decision Aid function, and it helps the patient receive the most appropriate care for things like lung cancer screenings. And finally, during your clinical encounters, you may use a smart phrase that can be loaded to the SOAP note to help you save time on documentation. Feel free to reach out if you have any questions and send us an email to quitstudy@fhcsd.org. The two main types of tobacco treatment medications to help your patients control their cravings are nicotine replacement therapy, NRTs for short, and non-nicotine medications. Many studies have shown using NRTs can double the chances of quitting smoking, and that combination therapy appears to be more effective than monotherapy. Combination therapy should be offered to patients as first-line pharmacotherapy. Although some of the medications may not be covered by insurance, they can be obtained over the counter. This may require discussion with your patient. Let's go into the EHR. Click on the problem list, go to the tobacco user orders set, and focus on the tobacco treatment medications list to check recommended combinations. When it comes to nicotine patches, they are prescribed based on the typical number of daily cigarette use, and they come in a nicotine system kit or in single dosages. The order set in EHR provides one option for prescribing based on daily use. It is possible to meet your patients where they're at, as oftentimes the standard dose is not enough to curb cravings, and we recommend for more than 1 pack per day, 21 milligrams a day for 6 weeks, then 40 milligrams a day for 2 weeks, and then 7 milligrams a day for 2 weeks. And for less than half a pack per day, 14 milligrams a day for 6 weeks, then 7 milligrams a day for 2 weeks. Oftentimes, your patients will require a higher dose. If they report cravings, consider going up to the higher dose of nicotine patches than what they are currently on, or discuss combination therapy. The first combination is a long-acting NRT plus a short-acting NRT, which is used as needed. The patches are prescribed based on the typical number of daily cigarette use. Use the gum and lozenges as PRN breakthrough treatment. Combine the patches and the gum. The gum can be used based on the time to the first cigarette of the day. Less than 30 minutes, 4 milligrams. More than 30 minutes, 2 milligrams. And or the quantity of the cigarettes a day. More than 20 cigarettes a day, 4 milligrams. And less than 20 cigarettes a day, 2 milligrams. You can also combine the patches with lozenges. The dosage is the same as for the gum, and is also based on the time of the first cigarette of the day and or the quantity of the cigarettes a day. And please remember to look up usage instructions and inform your patients as needed. The second combination is NRT plus oral non-nicotine medication. Combine patches and bupropion. We recommend 150 milligrams once a day for 3 days, then 150 milligrams twice a day for 4 days, then, on quit date, and please set one with the patient, stop smoking and continue 150 milligrams twice a day for 8 to 12 weeks. Additional 12 weeks may be considered, and there's no need to taper. Or combine bupropion as above, plus nicotine gum or lozenges, as explained previously, for acute cravings. The third and last combination is an NRT plus oral non-nicotine medication. Combine the patches and varenicline and prescribe the starter dose and the maintenance dose. 0.5 milligrams once a day for 3 days, then 0.5 milligrams twice a day for 4 days, then on quit date, and please set one with the patient, stop smoking and take 1.0 milligrams twice a day for 11 weeks. May continue for additional 12 weeks. Please remember to discuss contraindications and side effects with your patients. If you have any questions, please don't hesitate to send us an email to quitstudy@fhcsd.org.
From the published scientific literature, as well as interviews conducted with our own patients at family health centers, we know that patients highly value and trust the advice given by their primary care provider about the impact of tobacco on their health. With this knowledge, our hope is that you feel more empowered to utilize these tools and introduce them to your patients who use tobacco and who wish to quit. A small shift in the way you speak to your patients about tobacco treatment may make a huge impact on how they change their behavior and subsequently their health for the rest of their lives. Please do not hesitate to contact the study team with any questions at quitstudy@fhcsd.org. Thank you for your time and efforts. We appreciate all that you do.